So, okay, today actually prostate is supposed to be there, but there's a small change. Tomorrow we'll discuss the prostate and the
किरण फांका আছে তো জায়গা তো আছে এ ভাই ব্যাস হয়ে গেল সরে যা আরে সুমি ম্যাম বলেছে ডায়াগ্রামটার নাম হচ্ছে ওই সাইডে
So let us focus everybody. Okay, understand? It's a small topic. Let us finish it off fast.
Fasting, sir. Fasting.
It's a small topic, okay? But it's an important topic, okay? Because it will be asked in short notes. Okay, we'll discuss that what it is. Today we're going to discuss about male external genitalia. Okay, external we have seen internal genital organs like testis, right? Okay. Now let us finish it. Now everybody, let us finish it off fast. So today we're going to discuss about male external genitalia, which includes penis and scrotum. Okay. Penis is a male copulatory organ. Is it or not? Male copulatory organ is penis. Okay. First of all, we begin with the penis and then followed by the scrotum. So penis contains two parts. One is root, which is also termed as the radix, and the other is body. Okay, so basic things. Okay, so the penis contains, which is the copulatory organ of male, which contains the root or radix, and then followed by the body. Whatever it is exposed outside of the body is the body of the penis. Could you understand? Okay, root is hidden inside within the superficial perineal pouch. You know where is superficial perineal pouch or not? Right? So the diaphragm will be there, diaphragm will be there. Okay. Below that will be the superficial perineal pouch. Above that will be, within that will be the deep perineal pouch. Is it not? Right? So superficial perineal pouch over here. So within the superficial perineal pouch is the situation of the root or radix of the penis over here. Got it? So the root or radix contains among them, the root contains two parts again. One is the crura of the penis over here, or crux. Singular is the crux, and plural is the crura of the penis, just like the crura of the diaphragm over here. Okay, and then one more thing is the bulb of the penis. Okay, let us see that in the diagram.
নিচে
পড়লে কিন্তু পিটাবো। ভালো কুশন
So look over here.
আসবে।
This part, what you are doing is exposed outside of the cubic angle. What is that? Outside the cubic angle. So now we are focusing on the sagittal section over here. Okay. So here will be the pubis, and this part is the pubic symphysis over here, and it's the pubic angle. Nothing but the inferior ramus of the pubis over here. So on the other side there will be one more ramus over here, ramus of the pubis over here, inferior ramus of the pubis over here. In between that, the copulatory organ will emerge out. So whatever it is seen outside is the body of the penis over here. Whatever is hidden within the body, deep to the perineum or superficial to the, what is this? Diaphragm over here, pelvic diaphragm over here is nothing but the superficial perineal pouch. Within that superficial perineal pouch is the location of the root or radix of the penis over here, which is made up of three parts over here. The two are the crura, which eventually forms the corpora cavernosa. You would have heard corpora cavernosa, right? So corpora cavernosa will be the ultimate result of these two crura of the penis over here. Okay. In between those two, there is a dilated portion of the corpus spongiosum over here. Corpus spongiosum, that is called the bulb of the penis over here. Bulb. These two are the crura of the penis. Individual one is termed as a crus, and this portion is nothing but the bulb of the penis over here. All these are located within the superficial perineal pouch. So this two crura will be attached to the internal surface of the ischiopubic ramus. Could you remember or not? Internal surface of the ischiopubic ramus. They are divided into three areas. Is it over? So the lowermost area will be having the what is this? Crura of the penis over here. So this right crura will be, right crus will be attached to the right side ischiopubic ramus, and left crus will be attached to the left side ischiopubic ramus. Okay. Right. And this bulb will be just below the superficial, perineal membrane. Do you know the perineal membrane, where it is situated? What is perineal membrane?
Inferior layer of
Inferior layer of
urogenital diaphragm.
urogenital diaphragm. Superior layer of urogenital diaphragm, inferior layer of the urogenital diaphragm. So the inferior layer of the urogenital diaphragm is termed as perineal membrane. To very much close to it, the bulb will be situated over here. Getting it over? So these two are attached on either sides to the bone. Nothing but the ischiopubic ramus on the internal aspect. But this bulb will be like close to the, what is it? Perineal membrane over here. Getting it over? Getting it over, right? For example, this is the deep perineal pouch. This is the superficial perineal pouch over here. Here will be the perineal membrane. So the bulb of the penis will be close to this part over there, in this manner. And corpora and the cuts will be situated on either sides. Getting it over? So these two are attached to the bones over here, but this will be very much close to the perineal membrane over here. Getting it over? Right? Could you imagine over? Right? The penis is suspended by two ligaments over here. We will see the coverings of the penis later. First of all, the penis, nothing but the body, is suspended by means of two ligaments which are made up of fibrous tissue over here. Okay, one is the suspensory ligament of the penis and one is the fundiform ligament of the penis. Okay. So for example, if there is a pubic symphysis over here. This is the pubic symphysis and this is the pubic tubercle and everything on one side. Okay, we are seeing on one side. Okay, this is the pubic symphysis. From the pubic symphysis, above the pubic symphysis will be, which structure will be present over here? Above the pubic symphysis towards the abdomen, which structure is present? Linea alba. An extension of the linea alba downwards over the pubic symphysis and goes towards the body of the penis and attaches on either sides of the penis over here and suspends the penis over here. That is called the fundiform ligament of the penis. Getting it out? So this fibrous tissue will be going downwards and will be holding the penis over here, suspending the penis over here. Getting it out? So which is termed as a fundiform ligament, which is a superficial one. And the deeper one in the similar pattern will be one more ligament which just lies deep to that. Will be, that is a suspensory ligament of the penis over here. Okay, so what is the difference between these two? So superficial is the fundiform ligament of the penis, which is a derivative of the linea alba over here. This will be attaching on either sides of the penis, and then continues with the scrotal septum. We'll be seeing that later. This is the scrotum over here. This is the scrotal sac over here. So this is the skin dividing the two right and left side scrotal sacs over here. Okay. But the dartos muscle, what is situated over here? For example, the dartos muscle, which is situated over here, it will go deeper over here, in between the two scrotal sacs, and forms a septum over here in between the two scrotal sacs over here. Two scrotal sacs will not communicate with each other. The testis on right side will not be entering into the left side, or left side testis will not enter into the right side. So this partition will be made by the dartos muscle. Will you get it out? Dartos muscle, which makes this partition. To this dartos muscle, this fundiform ligament will attach over here. Could you understand? So the fundiform ligament will be coming from above downwards, encircles the penis over here in this manner, and then continues with the dartos muscle in this manner. Could you understand? So this is the pubic symphysis over here. The fundiform ligament is a derivative of the linea alba over here. Goes downwards, encircles the penis over here, holds the penis and joins again below the penis and continues with this dartos muscle forming the scrotal septum. Septum means which divides a particular cavity to two, isn't it? Right? So this is the continuity of the fundiform ligament over here. But this ligament, which is a suspensory ligament of the penis, again it's made up of fibrous tissue. It is not a derivative of the linea alba, but it's a fibrous tissue extending all the way from the pubic symphysis over here and goes and attaches around the penis, but not continuous with the dartos muscle. So it is suspending only with the penis alone, which is not continuous with the scrotal septum over here, which is nothing but the suspensory ligament of the penis over here. The apex is situated towards the symphysis pubis, but the base is attached on either sides of the penis over here. Getting it out? So one will be superficial over here, one will be deeper, which are hanging the penis over here at the pubic angle. Could you understand right? Could you understand or not? So two ligaments are suspending the penis over here. Getting it out? So scrotal sac is of two sacs or single sac? Scrotal sac divided by a septum into two small sacs over here. Okay, that you are supposed to do. Okay. So let us see. Could you able to see everybody? I think your eyes are powerful, right?
Yes,
Right, yeah. Okay, right. So if you take the cross section of the penis, okay, the dorsal surface of the penis is situated above and ventral surface is below. But the penis, in case of resting phase, in case of flaccid phase, wherever it is not erected phase, it will be in this manner. Isn't that right? Glans penis will be in this manner, right? So how come this will become dorsal surface over here? It must be becoming anterior surface or ventral surface, and this must be becoming posterior surface or dorsal surface. But this surface is dorsal surface.
So because in anatomical position penis is erect.
Anatomical position?
Penis must be erect.
Obviously, in case of anatomical position, in case of males, there is no need for the penis to be always erected. Is it not? Normally it will be in the flaccid state. So how can it will become an anatomical position? Whatever you said is absolutely right, but how come? So in case of animals, four-legged animals, the penis will be directed horizontally. Is it not right? In case of animals, the penis is directed horizontally. So the upper surface will become dorsal aspect and the lower surface will become ventral aspect. So in the same manner, in case of males, in case of humans, to represent this part over here, in case of animals, this acts, even though it is appearing anteriorly, it is in an erected position, it will be dorsal aspect. Okay. So whenever it is erected position, it will be the same manner like that of the animals over here. So this part is considered as a dorsal surface and this part is considered as a ventral surface, and this is the actual anatomical position, not this. Could you understand it, buddy? Right? So in erected posture, this will become the actual anatomical position over here, and this will become the dorsal surface, and this will become the ventral surface over here. Could you understand it, right? So now we are going to see the cross section of the penis over here. Okay. Initially there are two crura which are attached on either sides to the bony pelvis over here. Is it alright? But then after emerging out of the pubic angle, both will join together in this manner. Could you understand? So if you go behind over here, they will separate. Could you understand? Like a conical cylindrical structures over here. Could you understand? So if you take from above downwards, if you see, these are the two crura on either sides. But in front, it will be joined together and separated by a small septum over here. Could you understand? So behind, there are two crura. In front, there will be a singular structure over here. That is termed as corpora femoris, exactly. Which is made up of fibro, elastic and muscular tissue. Okay. So the corpora cavernosa, of course the corpus spongiosum also is made up of fibro, elastic and muscular. Muscular here is smooth muscle fibers over here. Get it? Why these smooth muscle fibers are needed? Why this elasticity is needed? And why these collagen fibers are needed? Because it's a copulatory organ, obviously there must be erection and flaccidity will be there. Flaccidity means in a resting phase over here, not in erected phase. Okay. So for the erection, elasticity must be needed, and of course for the flaccidity stage also, and the muscular also makes it erected over here. Okay. And fibro to support everything. Getting it alright? So fibro, elastic and muscular. Okay. Right. So both the corpora cavernosa and corpus spongiosum is also made up of. Okay. And corpus spongiosum, posterior it will be dilated, and whenever it is becoming anterior, it will become narrowed over here. Get it alright? So this will be within the superficial perineal pouch. These two are also in the superficial perineal pouch. This part is outside the pubic angle. This part is outside the pubic angle over here. Okay. So on the anterior aspect of this, bulb of the penis, this will become corpus spongiosum over here. And at the terminal part, it will be leaving a dilated portion. That is termed as glans penis. Okay, glans penis is a dilated terminal portion of the corpus spongiosum. Okay, what is it? Corpus spongiosum. Okay. So corpora cavernosa are two, corpus spongiosum is only one. This you are supposed to know. Okay. So whenever it is emerging out of the pubic angle, this will be united together. Two pleura will be united together and forms a single entity over here, separated by a small septum over here. Okay, that septum is termed as septum pectiniforme. Pectin we know already, like a comb, honeycomb, not comb, not honeycomb, normal comb. What we used to comb with the thing, no? The same thing, comb like appearance over here. That means what you are supposed to understand here is this septum is irregular in this manner. Getting it out? Or ragged like this. Okay, this septum. So this septum is made up of fibrous tissue. How it is fibrous tissue, we will be discussing that later. But for now, you are supposed to understand two corporocavernous are separated by a fibrous septum over here. It is termed as septum pectiniforme. Okay. So these two corporocavernosa are made up of structure fibroelastic and muscular structure. Actually, these two corporocavernosa and corpus spongiosum is surrounded by a fibrous tissue. This fibrous tissue over here, separately. That means two corporocavernosa is surrounded by a separate fibrous structure, and one spongiosum is surrounded by a separate fibrous structure. This is termed as what is that? Tunica albuginea. Yesterday we have seen, no? Tunica albuginea. Tunica albuginea in the testis is the fibrous structure. Here also it is a fibrous structure, purely fibrous structure. Okay. So this is the tunica albuginea around the corporocavernosa, and this is the tunica albuginea around the corpus spongiosum. This corporocavernosa will be producing septate by moving into this cavity over here and forms this trabecular septate over here. Trabecular means meshwork of network. Absolutely. Okay, trabecular septate over here. So these are like, have you ever seen a maze? Have you ever seen a maze or not? So in the same manner, these septa will be coming all the way from the tunica albuginea and enters into this cavity over here. Get it over? And making it like a meshwork over here. Nothing but the trabecular septate. So what do you expect in these spaces? These are empty or filled with something else. Normally, when it is setting the septate over here, within this cavity, other than these septate, the areas over here are empty or filled with something. Empty. Generally it is empty. Okay. But these spaces are meant for the blood to be filled so that erection will happen. Erection is vascular. Getting it over? Of course, the nervous system is also acting, but erection is occurring. That means the penis in a flaccid state will be smaller and thinner, but it will become longer and thicker because of the accumulation of the blood within these cavities over here. Getting it over? Right? So then each and every corporocavernosa is made up of trabecular septate and empty spaces over here, which later on during erection will be filled with the blood over here. Okay, right. So these are tunica albuginea over here. Okay. So as a whole, this is one entity now. Okay, which is surrounded by the tunica albuginea. Above that, there will be one more fibrous structure, a little less thicker compared to the tunica albuginea, is termed as now we are looking after the coverings of the penis, okay, from deeper to the superficial. Fascia of penis. So outside the corporocavernosa and outside the corpus spongiosum is a tunica albuginea. Outside of everything is a fascia of penis over here. Fascia of penis. It is like a moderately fibrous structure, moderately thick fibrous structure. Okay. Above that, there will be areolar tissue. Try to understand this. This is very much thicker connective tissue over here, fibrous structure over here. That will be holding all these three. And above that will be moderately thick connective tissue, which is again made up of fibrous tissue, of course elastic tissue also, which is called the fascia of penis over here. Get it over? And then even above that will be, this area is the areolar tissue, much more loose areolar connective tissue, which is made up of again when it's a fibrous tissue over here. So this areolar tissue and fascia of penis are the superficial fascia of the penis over here. Could you understand? By this you can understand this is like a deep fascia over here, and this part is the superficial fascia of the penis over here. Got it? So superficial fascia contains two parts over here. One is the areolar tissue, and one is the moderately dense connective tissue, which is made up of fibrous structure again. That is called the fascia of the penis over here. Okay, and then even superficial to that, this part will be obviously superficial fascia will be skin obviously. This skin is consists of two parts. The penis will be in this manner, for example. This is the dilated portion of the penis over here. Dilated portion of the penis over here, which is called the glans penis over here. So till this part, the entire body, do you think that root of the penis will be covered with the skin? Root of the, because it is inside the body, it is not covered by the skin. Okay. So this is outside the body, which is called the body of the penis, and this part is called the glans penis over here. Okay. So the skin which is covering this body is termed as the mobile skin over here. Only skin which is mobile. Okay. But the skin, whenever it is reaching the neck of the penis, what are the parts? The other part of the penis is the neck of the penis. The junction between the body of the penis and glans penis is the constricted portion, that is called the neck of the penis over here. So whenever the skin is reaching the neck of the penis, it will be reflected over this dilated portion called the glans penis over here. Could you understand? Only the skin which is covering the glans penis is termed as, what is it? Prepuce. Okay. Okay. The skin which is covering the body of the penis is termed as the mobile skin, only skin which is mobile. Okay. But the skin which is covering the glans penis is termed as the prepuce over here. So what is the importance of the prepuce over here? Normally, in case of few religions, by means of circumcision, this prepuce will be removed. What for we are doing that? As doctors.
Because it gets attached to this surface and not
Attached to the surface. How it will be? Yeah, you are right. So how it is? How it will happen? What is that? How it will be? That's what you are saying is absolutely right, but how it is? See here? This is the body of the penis, we have already told. Okay, and this is the neck of the penis over here. Getting it on it? Right? And this is the glans penis over here. Okay. So this area, this neck and base of the glans penis will be having sebaceous glands. What is it? Sebaceous glands. Those will be secreting a structure called termed as, what is it? What is it? Smegma. Okay. Smegma. Okay. Smegma is the secretion of the sebaceous glands which are situated in this glans penis towards the base and of the neck also. Okay. So whenever these secretions are, in case of children mainly, which are collected over here. For example, this blue color structure is the skin over here. Okay. So whenever the sebaceous secretions are getting accumulated over here. Yeah, exactly. What is it? Phimosis. Okay. So whenever the sebaceous glands are accumulating over here, so what will happen? The kids will not be knowing that these are getting secreted over here rather than adults. Okay. So whenever it is getting secreted over here, they will get infected easily. Okay. Whenever it is getting infected, there will be inflammation over here. So followed by inflammation, what will happen? This will undergo fibrosis over here. So what will happen? This skin will become shrunken over here. This will not be retracted back. Normally the foreskin can be retracted back, but because of the inflammation and the fibrosis over here, so if it is entirely occupied by the fibrosis over here, fibrous structure over here. So because of this thickness, the skin can't be retracted backwards over here. Getting it on? And followed by this inflammation leads to obstruction of the urethra. Why? Because it is not retracting back, and further collection of this sebaceous gland occurs over here, which is nothing but this magma over here, and further spread of the infection over here. That leads to further inflammation. That leads to compression of this, what is it called, glans penis over here. So the urethra which is passing over here will be occluded over here. Get it out? So by this compression, the urethra will be occluded over here. Okay. So the patient can't able to pass the urine outside. Okay. So to prevent all these things, the foreskin of the penis will be removed. Nothing but the prepuce will be removed by means of a surgery called, what is that name? Circumcision. Circumcision over here. Okay. So that's why only the foreskin over here is termed as the prepuce over here. But this is a mobile part of the skin which will not be removed over here. Get it up? So, let us see from deep to superficial structures, and what are the structures which are embedded within these structures over here, or layers over here. Okay. First of all, within the corpus, corpora cavernosa, there are two arteries over here. Those are termed as, what are it? Those are termed as deep arteries of penis. Within the two corpora cavernosa, there are two vessels, arteries, which are the branches of deep arteries of penis, which are branches of, I have already discussed. Deep arteries of penis are branches of, what's that? Exactly, internal pudendal artery. Easy to remember. The genital, so obviously pudendal. Pudendal nerves will supply the penis, and scrotum and pudendal arteries will supply the penis and scrotum as well. Pudendal means genital along with the perineal region. Just remember blindly like that. Okay. So deep arteries of the penis are the branches of internal pudendal artery, which is a branch of anterior division of the internal iliac artery. Exactly. So deep arteries of the penis. You can understand the arteries are situated deep to the penis over here. Away from the skin is the deep. Is that right? Right. So within the corpus spongiosum there will be two arteries over here. These are called the arteries of bulb of penis. Arteries of bulb of penis. We have already understood that bulb giving rise to corpus spongiosum over here. Is that right? So arteries of the bulb of penis there will be two. So here a paired artery is nothing but the deep arteries of the penis, which are the branches of the middle pudendal artery, and again two branches of the paired arteries over here, which are again the branches of the internal pudendal artery, which are called as the arteries of the bulb of the penis. So these arteries will be supplying which structures over here? Arteries of the bulb can supply the corpus spongiosum and as well as the urethra over here. Do you understand? Right? So these arteries are the deep arteries of the penis over here. These will be supplying obviously corpora cavernosa. So these arteries will be giving rise to arteries called the helicine arteries into these trabecular septae. Because the trabecular septae are made up of connective tissue. So the branches of these arteries will be entering into the trabecular septae and will be leaking the blood into these open spaces over here. Could you understand? So this is a septum, trabecular septae in this manner, for example. Multiple trabecular septae in this manner, for example. If the artery is situated in the center over here, that is giving rise to helicine arteries, like spiral shaped arteries over here. So all these arteries will be entering into these trabecular septae over here. And these arteries will be giving rise to capillaries in this manner. So these arteries will be carried by this connective tissue over here, and these capillaries will be leaking the blood into the surrounding cavities over here, or spaces, open spaces over here, filling these cavities with the blood in this manner. Could you understand? The artery will be situated in the center, but the branches will be within the trabecular septae. Get it or not? But the blood will be leaked into these spaces over here. So whenever the blood is leaked into these spaces, it will become broader and wider also. So that is nothing but the erection of the penis. Okay. So for the blood to be leaked, so what nervous system has to be activated over here? Sympathetic or parasympathetic? No, think properly. Parasympathetic, absolutely. So sympathetic nervous system, what it does to the blood vessels over here? Sympathetic nervous system, what it does to the blood vessels? Constriction or dilatation? Constriction or dilatation is sympathetic. Vasoconstriction will be done by the sympathetic nervous system. Vasodilatation by means of parasympathetic nervous system. So because of the vasoconstriction, what will happen? The blood delivery will be faster but lesser in amount. Okay. But due to vasodilatation, the blood delivery will be slower but more blood will be delivered. But here less blood or more blood is needed for erection. More blood is needed. So which sympathetic activity is activated over here? Parasympathetic activity. So erection of the penis is by means of parasympathetic activity. Got it or not? So these are the arteries we have seen already over here, and let us see the other structures over here. Okay. So these are the coverings of the corpora cavernosa, corpus spongiosum. Above that will be the superficial fascia. Okay, superficial fascia is like this, areolar tissue and the fascia of penis. Deep to the fascia of penis, there will be a vein over here, which is called the deep dorsal vein of penis over here. What is it? Deep dorsal vein of penis. On the dorsal aspect of the penis, there is a deeper vein called the deep dorsal vein of penis. So obviously, if there is a deep dorsal vein of penis, there must be superficial dorsal vein of penis over here. Both are situated towards the dorsal aspect of the penis. One is deeper and one is superficial over here. If you see properly, within the areolar tissue is the superficial dorsal vein of penis, and below the fascia of penis is the deep dorsal vein of penis. So what might be these veins are doing over here? Think properly. So this vein is close to these two structures. Is it not? For example, if the veins are going all the way from here to here in this manner, from here to here in this manner, from here to here in this manner. So the corpus spongiosum and corpora cavernosa, the venous system, the veins from these three structures will be drained by these deep dorsal vein of penis. Could you understand? Could you understand?
Yes.
So in between these two structures, above, immediately above that will be the deep dorsal vein of penis. Whatever the blood which is released by these arteries over here will be, after metabolism or whatever it might be, will be drawn back through this vein. Is it not? So the vein will be draining by means of these tributaries on either sides of the corpora cavernosa and corpus spongiosum over here. So all these tributaries will be draining into this deep dorsal vein of penis over here, and the blood will be carried back into which vein? Great saphenous vein. Because great saphenous vein is very much close to the genital region over here, on either sides of the genital region. Getting it? So what is it? This is what, for example, this is the femoral vein over here, the major tributary of the femoral. You know the femoral vein, how it is formed. Is it not? Okay, fine. The popliteal vein on the back, that will be coming in front, that will be becoming the femoral vein. Okay, simply to say that, for example, how the external iliac vein is going and forming the femoral vein, femoral artery. Could you remember? External iliac artery becomes the femoral artery. In the same manner, femoral vein will be along with the external femoral artery. Could you understand? In the femoral region, femoral artery will be associated with the femoral vein. Could you understand? Okay. That femoral vein will be having a major vein that is nothing but the great saphenous vein, which will be draining the vein, or which will be draining the entire lower limb on the medial aspect. Have you ever seen on the medial aspect there will be dilated veins in some individuals? Have you ever seen? On the medial aspect of the thigh and the leg, have you ever seen any dilated veins? Those are called the varicose veins. Okay, so varicose veins occurs in case of great saphenous vein. So this is the limb over here. For example, this is the limb over here. Okay, on the medial aspect there will be a longer vein that is nothing but the great saphenous vein over here. Get it on? Into this great saphenous, because the scrotum will be over here and the penis will be over here. So the veins which are draining the penis are directly draining into great saphenous vein over here. Do you understand? Great saphenous vein is the vein of the lower limb. The lower limb is very much close to the genital region, so the veins are draining into great saphenous vein over here. Some veins will might be draining into internal iliac vein also. Getting it or not? Internal iliac vein also. Okay. Now we are focusing on the superficial dorsal vein of penis. So this vein is lying just below the skin. So this vein will be draining which structures? Skin, absolutely, and also prepuce, of course, skin, the mobile skin or the body of the penis, and also the prepuce, or which is also termed as the foreskin, and also the glans penis. Glans penis is also drained by means of this superficial dorsal vein of the penis. But you will understand, immediately above these structures is the deep dorsal vein, which will be draining all these three structures. But the superficial dorsal vein will be just below the skin, so obviously it will be draining the skin as a whole and also glans penis. This you are supposed to understand. Could you understand, everybody, right? And so, two other arteries and two other nerves just below the fascia of the penis over here, okay, which are termed as the dorsal arteries. So far we have seen the deep arteries over here, arteries to the bulb of the penis over here. But other arteries are the, just like the deep dorsal vein of the penis, there will be two dorsal arteries and two dorsal nerves over here. Get it or not? Right? So these dorsal arteries are again branches of internal pudendal artery, obviously. Again, the branches of the anterior division of the internal iliac artery. Could you understand? So these arteries and these arteries and these arteries are the branches of internal pudendal artery, which is a branch of the internal iliac artery. So all these branches are from the internal iliac artery. Get it or? So now these. Okay. So these veins are draining into great saphenous vein and ultimately into femoral vein. Okay, femoral vein, the main tributary is the great saphenous vein. The great saphenous vein will be draining into femoral vein, and then from there onwards into external iliac. Okay, that's the difference. And now these are the nerves over here. Why the nerves are needed over here? Got it? Why the nerves are needed over here? These nerves are the branches of the pudendal nerve over here. These nerves are the branches of the, what is that? Pudendal nerve. What might be the use of these nerves over here? Of course, sensation, the pain sensation will be carried over here. Any other? Any other? What? Absolutely, that is the thing. These nerves will be supplying the skin over here. Somatic nerve supply over here. Could you understand? Could you understand? The somatic nerve supply of the skin, the mobile skin and the prepuce is done by the pudendal nerve over here, which are in the form of dorsal branches of the penis over here. Okay. So this is very much close to the skin over here. So it will be supplying the skin. Could you understand? This will be supplying the skin over here. Could you understand about it, right? So we have identified the nerve supply which carries this pain sensation and also it supplies this, of course, it supplies the skin and it will be carrying the pain sensation over here. And then what about the vascular drainage over here? Vascular drainage is mediated by sympathetic and parasympathetic nerves, is it not? The vascular drainage is mediated by sympathetic and parasympathetic nerves. Those nerves are derived from, one is the sympathetic and one is the parasympathetic. Sympathetic nerves are derived from, what is that, right? Okay. So these are the sacral plexus of nerves over here. These are the sacral plexus of nerves, which gives rise to parasympathetic nervous system over here. Sacral plexus of nerves, just like the lumbar plexus, we'll be studying the sacral plexus later on. Okay. The sacral plexus out of ventral rami of S2, S3 and S4 will be giving rise to parasympathetic nervous system over here. Get it? So this parasympathetic system, what it does to the vessels over here, they will be dilating the blood vessels so that the more blood will be leaked into the spaces over here that will be erecting the penis over here. Okay. Then what about the sympathetic? Why sympathetic nervous system is needed over here? Ejaculation with respect to the blood vessels. With respect to the blood vessels, what will happen? Vasoconstriction, obviously. So after erection, obviously the male partner will be ejaculating out the semen over here. So whatever he said, the ejaculation is done by sympathetic nervous system. How the sympathetic nervous system does the ejaculation? How the sympathetic nervous system does the ejaculation? The vas deferens, the seminal vesicles, all these are or stimulated by means of the sympathetic nervous system. Could you understand? This vast difference. So one more thing, how the semen all the way from the testis against the gravity, moving against the gravity and will be delivered over here. Suction, absolutely. Suction action of the vast difference. How the suction action will be produced over here? How the suction action will be produced over here? How the suction, right? So you will be using for the babies to suck out the things from the mouth. You will be using a sucker, right? You know the sucker about? In case of pediatric patients, to suck out the mucus, they will be using a sucker. So how the sucker is working? So whenever you press it, obviously the air will be leaked out, so negative pressure will be created inside, so that will be sucking back. So in the same manner, because of the contraction of the muscle fibers over here, the suction action will be produced over here. So that will be delivering the semen against the gravity all the way from the testis into the urethra over here. Okay, prostatic urethra. We will be learning it later tomorrow. Okay. So this vast difference and seminal vesicles will be stimulated by means of the sympathetic nervous system. So ejaculation will occur. Is it or not? The seminal fluid, only the spermatozoa is produced by the testis over here. The seminal fluid, all the nutrition will be added by means of this vast difference and the seminal vesicles. Get it or not? So as a whole, the seminal fluid will be produced. So that will be ejaculated outside because of the sympathetic nervous system all the way from the L1 segment of the spinal cord. Could you understand everybody? So whenever the ejaculation is done, the vasodilatation is not needed, making the penis flaccid. Flaccid means in resting stage over here, not in erected stage over here. So immediately after the ejaculation, sympathetic nervous system will be coming into action. So that will be constricting the vessels over here. So obviously there will be flaccidity of the penis over here. Get it or? So the ejaculation and flaccidity of the penis will be done by the sympathetic nervous system. Get it or? And how the parasympathetic nervous system acts. For example, the blood is leaked into this over here. That will be drained back into the veins over here. So how it will be prevented? Because it should stay. The erection should stay for some time. Is it not? So the erection should stay for some time, so that the blood must be staying within these spaces over here. So how this is happening over here? What is it? Continuous? No, not continuous supply.
Constriction of the veins.
Exactly. So just like the compartment syndrome, I have told you already. To your batch or any other batch? Compartment syndrome I told. Is it the compartment syndrome of the hand? No. The same man. For example, if it is getting dilated, these things are getting dilated over here. The veins which are situated above will be compressed over here. So the venous return will be reduced over here. So the blood will be static at this point over here. Get it over? So the blood will be leaked by the arteries because of the action of the parasympathetic activity. So these cavities will be filled with the blood over here. So the blood will be staying for some time over there because the veins will be crushed because of this dilatation over here. Because of the pressure produced, the veins will be collapsed over here. So the venous return will be reduced over here. Get it over it? Right? So the blood will be staying here for some time, and later on the sympathetic activity will be coming into action. That leads to constriction of the arteries over here. So the blood will be returned back into the veins over here because there is a reduced pressure over here. Could you understand everybody? Could you understand everybody? Because ejaculation is the erection and ejaculation will be a short notes because it is based on the sympathetic and parasympathetic nervous system and the blood accumulation over here. Okay, right? Getting it over everybody, right? So because of the artery blood accumulated over here, it will be expanded, the pressure will be compressing the veins over here, so the venous return will be reduced over here. So after the ejaculation, the sympathetic nervous system will be compressing these arteries over here. So obviously venous return will be increased because these are compressed over here. Get it over? So the venous return will be increased over here. Got it? Okay. So in between these two, this septum is termed as septum pectiniforme. Do you think that this fibrous septum will be completely dividing these two compartments or not? Why not? Why not, right? Why not these two compartments must be completely separate? Why not? Blood flow? What will happen to blood flow? Two arteries are present over here. What's the need to be communicated on either sides?
It is symmetrical.
Symmetrical? Absolutely, almost all right. Symmetrical. Absolutely. If one artery is obstructed over here, who will supply the blood supply to this part of the compartment over here? Getting it over? In case of humans, the hepatocytes of the adjacent nucleus will be communicated or not? Or completely separate? Communicated, right? The same manner, these two compartments over here are communicated through this septum over here. For example, there is a block of this artery over here. This artery will be supplied to the entire things over here. Okay. These two dorsal arteries will be supplied to the both corpora cavernosa, corpus spongiosum, but this artery is absent over here. It is blocked over here. So there will be less blood supply over here. So what will happen? This compartment will be collapsed a little bit, but this will be dilated because of the normal blood supply. So what will happen? The penis will be curved over here. Could you understand? If this is the two compartments over here, the other two compartments, this is getting adequate blood flow, this is getting less blood flow. So what will happen? This will be more dilated and this will be less dilated over here. So obviously there will be curving of the penis over here. Do you think that curving of the penis is normal? Obviously it's abnormal. It will be leading to pain over here. Getting it out, right? So for that sake, there will be communication between the two compartments over here. So the blood will be evenly distributed on either side, even the one artery is blocked over here. Getting it out, right? Very good thinking actually. Okay, right. So what about the posterior aspect of these things over here? At the level of the posterior aspect of the crura over here, this fibrous tissue is, fibrous septum is continuous or without any openings or without any communication between these two compartments. Getting it out? For example, this is on the anterior aspect, towards the front aspect, these two are partly separated. But behind this, at the level of the crura over here, for example, this is a normal penis over here, for example, these two are the crura and this is the corpora cavernosa over here. Okay. So at the posterior aspect of the corpora cavernosa, both are these two compartments. These two are the corpora cavernosa. Both compartments are separated completely by means of this fibrous septum. But whenever it is moving on to the anterior aspect, these two are not completely separated but partly separated or incompletely separated. Getting it over? Right? So there is a disease called Peyronie's disease. What is the disease? Peyronie's disease. This disease occurs because of the aggressive and improper sexual intercourse by the male partner. Getting it out? So the Peyronie's disease is a disease because of the improper and aggressive sexual intercourse by the male partner, leading to fibrosis on the inner aspect of the penis over here. Because of the continuous irritation of the penis over here, there will be inflammation within the penis over here. Getting it out? So whenever there is an inflammation, obviously there will be fibrosis of the penis over here on the inner aspect. Whenever the penis is on the inner aspect is undergoing fibrosis over here, what will happen? There will be constriction of the penis over here. So what will happen? The penis will be curved downwards. It's an abnormal condition. Normally it is curved in this manner. But in case of Peyronie's disease, because of the fibrosis, this will be abnormally curved downwards. In case of erection, the penis will become straight in this manner. But in case of Peyronie's disease, even during erection also, it will be in curved manner only, leading to the pain of the patient over here. Getting it over here. What's the difference between Peyronie's disease and normal erection over here? Getting it over? Because of the fibrosis within the penis over here. So during erection also, the penis will not be coming straight over here. It will be still curved in this manner because of the inner fibrosis. Okay. That leads to pain of the patient over here because of this Peyronie's disease. Getting it out? Peyronie's disease will be a 2 marks question. Getting it out? So the blood supply and nerve action over the penis based on the ejaculation and based on the erection, there will be a shock nodes or ultra shock nodes over here. Do you understand or not? Right? Try to remember this. Ultra shock nodes are what are right? It's okay. You can understand. So let us finish it off fast way. Scrotum. Scrotum is nothing you all know very well. What is the scrotum? The layers of the scrotum all the way from outside to inwards. So first of all, the scrotal sac is divided by a median raphe into two small compartments over here. The left side compartment will be a bit downwards over here. It is developmental. Okay, no much significance over here. So obviously this is the left scrotum which is situated a bit below. What will happen? The testis also will be a bit below over here. Is it or not? Left side testis in case of males will be a bit below compared to the right testis. So what will happen to the spermatic cord over here? The spermatic cord will be longer in case of left-sided testis over here. The spermatic cord will be a bit, not a bit, which is normal on the right side, but longer on the left side. Getting it out? So the scrotum, what is it? The layers of the scrotum all the way from outside inwards. This is the skin. Deep to that will be dartos muscle over here, which is an involuntary muscle or voluntary muscle. Dartos muscle is an involuntary. Diaphragm is involuntary or voluntary? Diaphragm is made up of skeletal muscle or smooth muscle? Diaphragm is made up of skeletal muscle or smooth muscle? Come on. Diaphragm is a skeletal muscle or smooth muscle? Skeletal muscle. So skeletal muscle, what will happen after some time of after contraction, there must be lactic acid accumulation and it should not work. But how come we continuously breathe? So if you want to breathe deeply, you can breathe. Is it alright? For example, whenever you are running, you can easily deep breathe. Okay, that is even though it is voluntary, it acts as involuntary muscle. During sleeping, it obviously will be acting as involuntary muscle. You will not be constantly focusing on diaphragm movement. Is it not? Right? In the same manner, dartos muscle is a voluntary muscle, but it acts as involuntary muscle. For example, in case of cold climate, the rugosities of the skin is produced by dartos muscle. You know, the scrotal skin is not straight, not flat over here. There will be rugosities over here. Especially in case of winter, it will be much more rugosities produced over here because of the contraction of the dartos muscle over here. So at that time, males will not be contracting the dartos muscle purposefully, but naturally it will happen, which is an involuntary action over here. Even though it is voluntary muscle, it acts as involuntary muscle in certain conditions. Getting it on it? Right? So this dartos muscle will be forming a septum within the scrotum that is termed as scrotal septum. Obviously. The septum which is formed in the scrotum is nothing but scrotal septum, separating the two compartments over here. So one right testis will enter into the left side testis will enter into the right testis. Right. So this will be continuous with. What? No. What I'm asking is this dartos muscle, not over here, in the center. The septum will be continuous with just not fundiform ligament over. Fundiform ligament of the penis over. Okay. So fundiform ligament of the penis. Okay. So this dartos muscle, whenever it is reaching the abdomen, it will be continuous with the scarpa's fascia over here. Okay. So deep to the dartos muscle, what are the structures? You know that very well. External fascia, which is the derivative of external oblique aponeurosis all the way from superficial inguinal ring, and then further next to that will be cremastic muscle and fascia. Cremastic muscle is a derivative of which muscle? Internal oblique. Cremastic muscle is a derivative of internal oblique. Cremastic fascia. What is it? Cremastic fascia will be what is it? Derived from the fascia which is covering the cremastic muscle. Loops of the cremastic muscle is covered with the fascia. Isn't it or not? Are you able to remember the cremastic fascia? Where it is attached to cremastic muscle? Cremastic muscle, where it is attached? What is that one? Exactly. These are the loops or fasciculi of the cremastic muscle. The origin will be in the inguinal ligament, almost in the middle of the inguinal ligament, and the insertion will be towards the pubic tubercle over here. Okay. So this is one of the fascia which is in the scrotum over here. What it does normally, what is the use of the cremastic muscle? That will be lifting up the testis towards the superficial inguinal ring and will be acting as wall valve in case of prevention of inguinal hernia. Okay, prevention of inguinal hernia. Very good. So this is the cremastric muscle and fascia, and the next layer is renal spermatic fascia, which is a derivative of transverse fascia, fascia transversalis. Okay, and further deeper will be parietal layer of tunica vaginalis. Okay, so parietal layer of tunica vaginalis, then followed by renal spermatic fascia, then followed by cremastric fascia and muscle, and then followed by extra spermatic fascia, then followed by darkness muscle, and then followed by skin. So the root series of skin is produced by which muscle? Dartos muscle. Got it down to everybody, right? So the skin of the scrotum is supplied by, just like the penis over here, the anterior 1/3 of the skin. For example, you take the scrotum on one side of the skin, or on one side of the body. So this anterior 1/3 is supplied by L1 nerve, and the posterior 2/3 will be supplied by S3 and S4 segments over here. Remember this problem. L1 is from the lumbar plexus, S3 and S4 are from the sacral plexus over here. Try to understand this problem. So this skin is supplied by L1 nerve in front and S3 and S4 nerves behind. Could you understand? In the same manner, the penis is also supplied by L1 nerve, nothing but the what is it? Yeah, L1 nerve, what is that? Lumbar plexus is okay. L1 nerve, what is called? Sympathetic nervous system. S2 and S3 and S4 are from the parasympathetic nervous system. So in the same manner, L1 will be supplying the anterior 1/3 of the scrotal skin over here. Posterior 2/3 will be supplied by the S3 and S4 nerves all the way from the sacral plexus over here. Getting it out? Could you able to understand these dermatomal insertions over here? Could you able to understand? All the way from the lumbar region over here, and this is from the sacral region over here. Partly from the lumbar it is supplied over here, and partly from the sacral region it will be supplied over here. Just similar to the penis also. Penis will be extra thing will be somatic nervous system. Getting it out? So, what might be the arteries which are supplying the scrotum over here? Which arteries might be supplying the scrotum? What are posterior scrotal arteries, which are the branches of? What? Pudendal artery, obviously. So pudendum means genital. Just remember, pudendum means genital. All the nerves which are supplying the penis and the scrotum are from the pudendal nerves, and the arteries are from the pudendal arteries, which are the branches of the internal iliac arteries. Got it already, everybody? Getting it on? And the veins where it might drain? Obviously into the great saphenous vein or into the internal iliac vein, or sometimes into the external iliac vein. Got it already, everybody? Okay, as simple as that. Scrotum, this part is important for the viva. What is that? Scrotal septum is important for the viva. Which is formed, the scrotal septum is formed by which muscle? Dartos muscle. This is what you are supposed to remember. And one more thing, the left sided testis is a bit downwards because the scrotal sac is a bit downwards. Understood already, everybody? Right? Could you remember all the layers of the skin or the penis and all the layers of the scrotum? Okay, shall we see in the visitor?